scanning my environment. All right, before going into the patient's room, I would go to the computer and I would check for any nosebleeds, aspiration, any nasal polyps, any anticoagulant therapy, any chronic sinus infections, or any oral, facial, and sinus surgeries. And I see that everything is good, so then I would go to the patient. Knock, knock. Hi, my name is Ashley and I'm here to be your nurse today. I will be here to insert and remove your NG tube. I have to let you know that you will feel some discomfort in your nasal passage, and maybe, or maybe not, some gagging, but you will be okay. Is now okay enough time to do so? Okay, and do you have any questions for me, ma'am? No? Okay. I place my supplies on a clean surface. I go and perform hand hygiene. And Ms. Dog, can you please verify your name and date of birth for me? I verify the provider's orders. I then would put the patient in a high Fowler's position. I would raise the bed to my level of hips, and I would go ahead and lower the side rail. I would then ask, Ms. Dog, are you in any pain right now? Do you have any feelings of nausea or feel like you're gonna vomit? No? Okay. I would perform hand hygiene and begin the process. I would take out my NG tube from the plastic. I would get my lubricant and splatter it. And then I would go and don my gloves. I have already prepared my tape, and any anemones that she would need, such as tissues or the Emerson basin, would be at her bedside. And so now I would come and inspect her nasal areas. So I would check her nasal for any obstructions, any nasal polyps, any irritation, or septal defect. And then I would see that she's okay, and then I would go ahead and verify with her. All right, Ms. Dog, I see that you didn't have any problems on your chart, but I just want to make sure if you've never had any, recent nosebleeds, any nasal surgeries, or any nasal trauma. Okay, sounds good. And then now, can you please do close one ear and breathe through the other, and then close the other and breathe through the other. Bilateral patency is detected. And I will do her gag reflex. She has a gag reflex. And then I would go and auscultate her lungs and then her abdomen. I see that her lung sounds are clear, her abdomen sounds are normal. So I would then come and take an NG tube, and I would measure from the tip of her nose to her ear, lobe, and then to her xiphoid process. I would mark where I located it with the permanent marker. I would then go ahead and get everything moved to her bedside, and then I would lubricate it, the NG tube up to 4 inches. And I would attach my syringe to the NG tube. It won't fit, but that's okay. And so now I would go ahead and tell her, all right, Miss Dog, I'm gonna insert it now, and you're gonna feel some discomfort, and I would like you to swallow, and I will be moving it along as you swallow, okay? So I will move it down and backward, steadily, holding on to it the whole time. Okay, I see that I reached the point. I would go ahead and anchor it with a piece piece of tape. Okay, I anchored it, and now I would put on a second piece of tape to anchor it. And now I would go and place my syringe, and I would extract the gastric contents. I would go and dispose of it in my gastric container. I would do a pH and verify that it's within normal limits. And then I would verbalize that I would take it to the x-ray if it was needed for feeding. And then I would also say that whether or not I need to replace the gastric content or just discard of it. I see that it is normal, so then I go and I anchor her tube to her gown, and then I clamp it with the container, and then I assess that her head is still at a 30-degree position. And then, all right, Miss Dog, I'm now going to remove the NG tube, okay? So I would untape it from her nose, and I'll tell Miss Dog, can you please hold your breath, okay? And I'm going to remove it slowly and gently, okay? I remove it. I make sure it is still intact. Then I would discard of it in the trash. I would then throw away my gloves. I would perform hand hygiene. I would raise her side rail. I would lower her bed to lowest level, make sure it locks. I would put her call light within reach. I would thank the patient, perform hand hygiene, and go document.